Hello, everyone, and welcome to another episode. Right to Health, a historic law, was implemented for the first time in India in the state of Rajasthan on 21st March 2023, that is this year. What is this law? Why was it important to bring healthcare under a right and a law? What difference will it make in people's lives? And what impact can it have outside Rajasthan in the rest of India? We'll talk about all this in this episode, but before that, I want to share a quote. In 1948, when the National Health Service NHS was implemented in the UK, which is an example for the world, the architect of NHS, Anirudh Bevan, had said, illness is not an offense for which people should be penalized. It is people's misfortune whose cost must be shared by the community. I'll first take a minute to highlight a few very important healthcare schemes that have been implemented in India in the past few years, both at the state level and at the center, before I explain why this law. In 2018, Prime Minister Modi implemented a milestone step by bringing Ayushman Bharat, which aims to give a free health insurance to every poor family in India for an amount of 500,000 rupees per year. However, this is only for the poorest families. For example, you will not be eligible if you own a two-wheeler, have a refrigerator or a landline, have a decent solidly made house, and many such clauses. In 2021, Rajasthan government implemented a healthcare scheme called Chiranjeevi Yojana, which was later extended to all residents of Rajasthan. And the amount in 2023 was made five times that of Ayushman Bharat, that is for 25 lakh rupees or 2.5 million rupees per year per family. For poor families, the insurance is free. Those above the poverty line need to pay a nominal fee of 850 rupees a year for the full insurance, which roughly translates to around 10 US dollars per family per year. These healthcare schemes should ideally cover a decent healthcare expense for every family. Why was it then required to bring healthcare under a right and a law? Implementing this law came under a huge opposition and protests from private doctors. But somehow the government stood its stand that not implementing this right is not an option. Why implementing health as a right is essential, which no amount of health insurance would be able to achieve. To understand this, let us take a look at a few very common and devastating problems patients face in India, which most people in India can relate to. A person needing urgent treatment in an accident or emergency is delayed admission or denied admission due to requirements of police clearance, legalities, and filling forms for bureaucratic compliance, during which critical time is lost, which might lead to the death of the person or irreversible damage to the person. This was famously depicted in a very popular Bollywood comedy movie called Munna Bhai MBBS.
सुन डॉक्टर वो बेचारा मर रहा है कुछ करना
सॉरी उसे कैजुअलिटी में ले जाइए आई एम ऑफ ड्यूटी नाउ
ऑफ ड्यूटी बोले तो जहर खाया है तुम्हारे सामने मर रहा है तो ऑफ ड्यूटी बोले तो
देखिए इट्स अ केस ऑफ अटेम्प्टेड सुसाइड पहले पुलिस फाइल बनवाना पड़ेगा
Number two, treatment is denied because of caste, excuses of being too occupied, or a whim, or for not being sure if the patient can pay or the money can be recovered from the insurance. Number three, patients are made to feel that a favor is being done to them because you are being treated through a government insurance and are often kept in the dark regarding their treatment, costs, privacy of their data, etc. It becomes difficult for them to ask questions on what are the tests being done on them, what are the cost of each test, whether they have an option of a different treatment, whether they have a choice of where to buy their medicines from, what would be done to the privacy of their data collected on them, etc. Number four, if a patient is denied treatment or delayed treatment or faces harassment or gets a negligent treatment which can be life ending or life changing, can they fight against huge medical organizations to get justice, especially if they are poor? Will it be endless court cases for seeking justice against a powerful system where it is not even worth thinking of fighting? All the above issues can be life damaging. No amount of insurance will ever solve them unless a right and an easy access to law and time bound justice is given along with the insurance schemes. What does the law state? Broadly, the law states this. Number one, Every resident of Rajasthan will have the right to avail free outpatient and inpatient department services for consultations, drugs, diagnostics at all government health centers and designated private health centers. Number two, in case of accidents and emergencies, no police clearance will be required, no delay or refusal to admit, and no asking for showing funds. Number three, every patient will be given adequate information on the illness, taken consent on the treatments, tests to be done on them, given a choice of the treatments, choice of the drugs, and choice of the places to buy those drugs from. Number four, every patient will have access to a system for time bound grievance redressal within 24 hours. I'll break down each of these to show why each of these clauses are hugely significant, immensely essential to actually access healthcare in a practical way, which just schemes will not be able to address. Firstly, all residents of Rajasthan will be able to get free treatment in private healthcare facilities along with government healthcare facilities. To understand why this is significant, here is the data. Professor Radhika Jain from University College London ran a statistics for 4 years after Rajasthan's Chiranjeevi insurance scheme was implemented. She found that 75% of the claims for these insurance schemes were from private healthcare centers. This shows that just government healthcare centers are not enough, and 75% of the people need to access private health centers to get any meaningful treatments. This act will lose any seriousness unless everyone can walk into private hospitals and get medical treatments like consultations, drugs, diagnostics for free as a right. The second clause is even more significant. In case of accidents and emergencies, as we saw before, there was a ridiculous system of legalities which hugely delay treatment when time can completely change someone's life. It was essential to make a law that states that a patient must be given admission into government as well as private hospitals without any delay, without needing any police clearance, and without showing any evidence of funds. If the patient is unable to pay for it, the government will reimburse the private hospitals for the entire medical costs so that the private hospitals will not need to worry about any loss to their business. In case of wrongdoings in medical treatment, in case of harassments, where will individuals go to seek justice against huge medical organizations, especially if they are poor? To solve this, two independent bodies will be established. They are called District Health Authority and State Health Authority. The system will work like this. A web portal and helpline center will be established for filing complaints. The concerned officer will have 24 hours to respond to the complaint. If a complaint is unresolved, the District Health Authority will take it and must take appropriate action and upload the action report on the web portal within 30 days. If the District Health Authority does not resolve the grievance within 30 days, the complaint will be forwarded to the State Health Authority. The State Health Authority will take actions against District Health Authority's decisions if they are not solved satisfactorily. The most important thing in this is that all of it will be documented and preserved online so that evidence cannot be erased and justice have to be given at some point, which will ensure the accountability of a medical caregiver at every point in the chain. Patients are often made to feel that a favor is being done to them by giving them free treatment. They are often kept in the dark on what are the tests and treatments to be done on them, what would be a plan of cost, and if they have a choice of where to buy their drugs from or which treatments to opt for, etc. With this law, it will be binding on the medical carers to give every bit of this information to a patient and seek their consent. Seek their choices on the medicines they buy, where they buy them from, on the treatments to be done on them, tests to be done on them, their costs, and all available options to choose from, instead of health authorities making arbitrary decisions that are forced on a patient. Today, many times, patients in India are handed a huge bill and told to buy drugs from certain centers, while patients are too scared to raise a voice against medical authorities on whom their life depends. The law also states that every patient will have a right to privacy of the data collected during the treatment and how that data is being used. No refusal of treatment can be done to a patient based on caste, social status, or excuses of being too full. It is a right for every citizen, and a health center will get fined and penalized if they refuse it to a citizen, no matter who. Let us take a look at what is the kind of cost for implementing right to health and is that spend justified? Let us see some facts here. In 2017-18, Rajasthan's actual spend on healthcare was 10,000 crore rupees. In 2022, the health budget was increased to 20,111 crore rupees, which is more than a 100% increase in budget in 5 years as the government planned for right to health. After implementing right to health, it is estimated that at least a recurring 14.5 crores will be spent every year. This will make Rajasthan's healthcare spend 7.4% of its total budget. If we look at overall India, if we combine the spend of both the center and the states, the total budget on healthcare in 2022-2023 is 2.1% of India's GDP, which makes India's healthcare spend 2% of its total budget. If we look at the state level, the average spend of all states in healthcare is 6% of a state's budget. So, if Rajasthan spends 7.4% of its budget in healthcare, it is way more than average. So, does it mean it is a very radical and risky step? To understand this, let us compare India's healthcare spend with the rest of the world. Year 2020's data show that India ranks 169 out of 195 countries in the world in terms of its spend on public healthcare as a percentage of GDP. It ranks better than Bangladesh and Pakistan, but is worse than most developing countries in the world. If entire India spends 7% of its budget in healthcare, India will rank around 80 in the world, which is comparable to countries like Ireland. To give a like for like comparison, UK's GDP is similar to India, but India's population is 21 times more than UK. UK spends 11.3% of its GDP on public healthcare. India spends 2.1% of its GDP on public healthcare. So, UK spends over 5 times more than India for 1/20th the number of people, which means UK government spends over 100 times more money per person per year for healthcare. It is not to compare countries, but to show what is a ballpark of spend that is required to ensure good public health care for a country. It is important that India, being the fifth largest economy in the world, increases its spend on public health care, which is commensurate with its progress. Let us see why is this a milestone and how can it have an impact on entire India. Firstly, this law is likely to force other political parties in different states to implement similar laws. Recently, welfare schemes in India have played a huge role in election wins, and political parties are seen to compete with each other in welfare. If that happens, slowly right to health can spread in entire India, and every Indian citizen might soon be able to access healthcare affordably in a dignified way. Secondly, Rajasthan has now provided a model on how to gain success against any opposition that tries to stop this law, which can be from doctors or private hospitals or any organization. Thirdly, implementing this right will force the government to build more public healthcare infrastructure, both in terms of actual physical hospitals and health centers, as well as digital infrastructure. Fourthly, area-wise, Rajasthan is the largest Indian state, with many deserts and sub-rural areas where healthcare delivery is not optimal. If Rajasthan government can make this model successful, it can be a huge learning template for other parts of India in terms of reaching healthcare to vast areas which are unconnected and with less infrastructure. Fifth, and most importantly, a scheme can be stopped anytime by a new government, but a law once made cannot be undone easily. So, even if a new government comes tomorrow, taking away a right will be politically extremely difficult. There are still a lot of limitations to the law which still need to be ironed out. For example, criteria for emergency care at the moment only includes a small set of cases like animal bites, electrocution, accidents, etc. While many other urgent health necessities, which would also require urgent treatment, are left out for now. Access to free treatment in private hospitals is a great step. But at the moment, it is only selected private hospitals where people can exercise that right. Over time, a lot more private hospitals and doctors need to be brought under this so that the access is actually possible wherever needed. Also, in terms of healthcare availability in India, at the moment there is a dismal data. There is only one doctor per 1400 people, one bed per 700 people, and one nurse per 600 people. In villages, people still walk for miles to reach the nearest health center. A lot more infrastructure need to be built to give more access to medical treatment wherever it is required. However, this right is a historic step and a milestone for India, which can pave way for a major change in coming years for every Indian citizen's access to healthcare in a dignified way, leaving no one out. It is commendable that someone has thought about it and someone has fought with huge medical organizations for months to implement it successfully. Do let me know what you thought of this video in the comment section below because that is hugely important for me. And if you like the video, please do keep following, please share, and please subscribe. See you in the next episode.